Hi everyone. Welcome to our channel where we discuss important health topics that can impact you and your loved ones. Today, we're diving into a condition that affects many newborns and their families. Let's talk about Erb's palsy. This condition, also known as brachial plexus birth palsy, is something that can be quite concerning for new parents. But don't worry, we're here to break it down for you in simple terms. Erb's palsy is a condition that primarily affects a baby's arm. It occurs when the network of nerves near the neck, known as the brachial plexus, gets injured. These nerves are crucial because they control the muscles in the shoulder, arm, and hand. The brachial plexus is a group of nerves that sends signals from the spine to the shoulder, arm, and hand. When these nerves are damaged, it can lead to weakness or even paralysis in the affected arm. This injury often happens during childbirth, especially if the delivery is difficult. These nerves are responsible for controlling the muscles that allow the arm and hand to move. When they are injured, it can make it hard for the baby to move their arm or hand properly. This can be very distressing for parents to see. Erb's palsy usually occurs during birth. It can happen if the baby's neck is stretched to one side during a difficult delivery. This stretching can cause the nerves to tear or become damaged. While it's most common during birth, Erb's palsy can also occur later in life due to accidents or trauma that impact the shoulder area. For instance, a fall or a car accident can sometimes lead to this type of nerve injury. It can be a challenging condition for families to deal with, but there is hope. With the right medical care and physical therapy, many children with Erb's palsy can regain significant function in their arm and hand. Early intervention is key to improving outcomes. In this video, we'll explore Erb's palsy in more detail. We'll look at how doctors diagnose the condition, the various treatment options available, and what parents can do to support their child's recovery. Stay tuned to learn more about this important topic. Brachial plexus injuries, often referred to as BPIs, occur when the network of nerves that send signals from the spine to the shoulder, arm, and hand are damaged. This damage can happen in various ways, such as stretching, tearing, or even being completely ripped apart. The brachial plexus is a complex web of nerves that controls muscle movements and sensations in the upper limbs. When these nerves are injured, it can lead to significant functional impairments and pain. These nerves are crucial as they transmit messages from the brain to the arm and hand, enabling movement and sensation. When the brachial plexus is injured, these signals can be disrupted, leading to a range of symptoms from mild tingling and numbness to severe pain and paralysis. Understanding the role of these nerves helps in comprehending the impact of their injury. When the brachial plexus is hurt, the arm and hand can become weak or even paralyzed. This weakness can make it difficult to perform everyday tasks, such as lifting objects, writing, or even dressing. Physical therapy is often required to help regain strength and function, but recovery can be a long and challenging process. One of the most common causes of brachial plexus injuries is a difficult childbirth. During delivery, if the baby's shoulder gets stuck behind the mother's pelvic bone, known as shoulder dystocia, it can stretch or tear the brachial plexus nerves. This type of injury is more likely to occur in larger babies or in cases where labor is prolonged and complicated. The risk of brachial plexus injury increases if the baby is larger than average or if the shoulder becomes lodged during birth. Obstetricians are trained to handle such situations, but despite best efforts, injuries can still occur. Parents should be aware of the signs and symptoms of brachial plexus injuries in newborns, such as a lack of movement in one arm or an abnormal position of the arm. Brachial plexus injuries can also result from traumatic events such as car crashes, falls, or sports injuries. In these scenarios, the force of impact can stretch or tear the nerves. Immediate medical attention is crucial to assess the extent of the injury and to begin appropriate treatment. Protective gear and safety measures can help reduce the risk of such injuries in high-risk activities. In some cases, tumors can develop near the brachial plexus and exert pressure on the nerves, leading to pain and dysfunction. These tumors can be benign or malignant, and their impact on nerve function can vary. Early detection and treatment are essential to prevent permanent damage. Patients experiencing unexplained pain or weakness in the shoulder or arm should seek medical evaluation to rule out such conditions. There are different kinds of brachial plexus injuries, commonly referred to as BPIs. These injuries can vary significantly in their severity and the impact they have on the affected individual. Understanding the types of BPIs is crucial for proper diagnosis and treatment. The severity of a BPI depends on how badly the nerves are hurt. The brachial plexus is a network of nerves that send signals from your spinal cord to your shoulder, arm, and hand. When these nerves are damaged, it can lead to varying degrees of functional impairment. Neuropraxia is the most common and least serious type of BPI. This condition occurs when the nerve is stretched but not torn. It's like a temporary loss of function, similar to when you stretch a rubber band without breaking it. The nerve remains intact, and recovery is usually complete within a few months. Imagine stretching a rubber band. It's not broken, just temporarily elongated. This is what happens in neuropraxia. The nerve fibers are intact, and the prognosis is generally good, with most patients regaining full function over time. Axonotmesis is a more serious condition where the nerve fibers are torn, but the outer covering of the nerve remains intact. This type of injury can lead to significant functional impairment, and recovery may take longer. The nerve fibers need to regenerate, which can take several months to years. Neurotmesis is the most severe type of BPI. In this condition, the nerve is completely severed, and both the nerve fibers and the outer covering are damaged. This type of injury often requires surgical intervention to repair the nerve, and even then, full recovery may not be possible. Avulsion is a rare but extremely serious type of BPI, where the nerve is torn away from the spinal cord. This type of injury is often irreversible and can lead to permanent loss of function in the affected arm. Treatment options are limited, and the focus is usually on rehabilitation and managing symptoms. Erb's palsy, a specific type of BPI, presents with various signs and symptoms. These symptoms can vary depending on the severity of the injury and the specific nerves affected. Early diagnosis and intervention are crucial for improving outcomes. Common symptoms of Erb's palsy include a weak arm, reduced muscle strength, difficulty moving the arm, and sensations of numbness or tingling. These symptoms can significantly impact daily activities and quality of life. In more severe cases, the arm might hang limp by the side with the hand turned inward, resembling a waiter's tip position. This characteristic posture is a hallmark sign of Erb's palsy and indicates significant nerve damage. Early intervention, including physical therapy and in some cases surgery, can help improve function and quality of life for those affected by Erb's palsy. Physiotherapists are really important for Erb's palsy. They figure out what's going on and make a plan. First, they ask questions about the birth, any accidents, and how the child is growing. Then, they look at how the child stands, moves their arm, and uses their muscles. They check how much the child can move their shoulder, elbow, wrist, and fingers. They also check how strong the arm muscles are. The main goal of physiotherapy is to help the child move their arm as much as possible. Passive range of motion is important, especially at the beginning. The therapist or parent gently moves the child's arm to keep it flexible. As the child grows, they do strengthening exercises to make the arm stronger. Sensory stimulation is also important. The therapist uses different textures and temperatures to help the child feel and control their arm better. There are new ways to help kids with Erb's palsy. Botox injections can relax tight muscles in the arm, helping it move better. Sometimes, surgery can help too. Doctors can do nerve grafts or move tendons to help the arm work better. Robotics and virtual reality are also being used to make therapy fun and help kids improve their movements. Doing exercises at home is really important. Parents play a big role. Here are some examples. Shoulder shrugs, lift shoulders up. Bicep curls, bend the elbow. Wrist extensions, bend the wrist. And finger plays, playing with blocks or puzzles. Be careful not to stretch the arm too much or use force. Always listen to the physiotherapist. If the child feels pain, stop and talk to the therapist. With early help, regular therapy, and family support, children with Erb's palsy can do really well.